Monkeypox cases in North Carolina have doubled in the last 2 weeks. And just today, Mecklenburg County confirmed the first known case in a child in North Carolina.
Today's update shows 261 cases in North Carolina. That's up from 114 cases 2 weeks ago and 34 cases 1 month ago. WRAL's Joe Fisher is live in Raleigh now with how doctors are reacting to the pace at which monkeypox is spreading. Joe?
Deborah, today marks 2 months since the first case of monkeypox in North Carolina. In the last week, we have been averaging 11 new cases every day. Doctors say it is slow but steady, and they do expect cases and infections to go beyond just men who have sex with men.
At Charlotte Pride over the weekend, monkeypox vaccines were offered on the spot.
If you can get it right now, you don't have to make an appointment. Made it very easy.
In North Carolina, 4 out of every 10 infections are among people who live in the Charlotte-Mecklenburg area, where today health officials confirmed the first known case in a child.
Let's be clear. Right now, we're seeing sexual transmission predominantly, but it wouldn't take too much to start seeing this start to be spread in other ways.
As cases climb, UNC's Dr. David Wall says the virus could spread in new ways, including athletics.
I do worry a little bit about sports teams, given the intimate contact that occurs with contact sports.
At the highest risk are gay and bisexual men and transgender people. Dr. Wall is encouraging those who are sexually active to get vaccinated, monitor for symptoms, and be thoughtful about sexual partners.
You have to know your partner. And even if you don't know them, know them. That means talking, any new lesions, any new bumps or ulcers that I should know about. And I have to say it, if you're going to be intimate with someone, maybe just take a look before you leap and, just check each other out.
To stretch the existing supply of vaccine, the CDC is now allowing providers to split doses into 5 smaller doses. Dr. Wall says it makes sense in high transmission areas like New York City or Miami, but not in places like North Carolina.
The reason we're doing this is because we don't have enough vaccine. And that's what concerns me, is that with yet another outbreak, we are behind the 8 ball.
And right now, black men make up nearly 70% of cases in our state, yet only 26% of vaccinations. White men make up only a quarter of cases, but more than 60% of vaccinations. Health officials here at DHHS say they are aware of the disparity and they're working to address it through targeted vaccination efforts.
Boy, a lot to keep talking about here. Joe Fisher live in Raleigh. Thank you, Joe.